and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, I'm sure all of you are seeing a lot of death, despair all around. But do remember, as we continue to report all these stories, there are a huge chunk of people who are recovering. And for you to recover well and recover fully, now a lot of attention also needs to shift to post-COVID care. I'm sure you've by now known and heard of cases of how in certain cases we've seen heart problems emerge as a fallout of COVID-19. That's something that we will pick on today, and we will be talking to experts also, the best of cardiologists across the country, to try and bring you authentic details of what is it you need to watch out for, and as a result, what is it that you can do. So let's dive straight into our explainer. Now, the COVID-19 disease has also of late led to a lot of heart damage, muscle, and affect various heart conditions as well. What do I mean by that? Now, while COVID care is drawing a lot of attention at this time, today we want to draw your attention to post-COVID care, which often gets ignored. While each person, remember, is different, and severe COVID often has some lingering ailments. Some people feel body fatigue, some have respiratory complications, but there are some serious ones which are often not detected. It is important that even after testing negative, there are things that you are careful about. Now, more and more health experts in India and across the world have now warned of cardiac arrests at times and complications in post-COVID recovery that could cause a cardiac arrest and in extreme cases a heart attack as well. Doctors are getting increased cases of heavy breathing, palpitation, fasting of the heartbeat in people who have recovered from COVID. So I urge you first up not to panic. Please understand that each person has different levels of COVID infection. There are mild, moderate, severe cases, and complications may differ from person to person. But if you look at the heart issues really, what are the things that you need to watch out for? What are the complications that can emerge and why it happens? The science behind it actually tells us that heart damage can be due to high levels of inflammation circulating in your body. As the body's immune system fights off the virus, the inflammatory process can damage some healthy tissues, including those in the heart. COVID-19 infection also affects the inner surface of the veins and arteries, which can cause blood vessel inflammation, small damage to vessels, and some might lead to blood clots as well, all of which can compromise blood flow of the heart or other parts of the body. So what should you do? Symptoms that you need to watch out for. Now, after you have recovered from COVID-19, if you're experiencing any of the following symptoms, contact your doctor. If you're feeling your heart beat rapidly or irregularly in the chest, what's commonly called palpitations. If you're feeling lightheaded or dizzy, especially upon standing. If you have a chest discomfort. If you have severe fatigue. If you have shortness of breath and chest pain as well, contact your doctor. The question then emerges is a heart attack more likely after COVID-19? Again, not everyone will have it. In extreme cases, we have seen doctors talk about a case of heart attack. In fact, heart attacks can be caused by increased stress as well on the heart, lower blood oxygen levels or anemia as well, because the heart muscle isn't getting enough oxygen delivered to the blood in order for this extra work to take place. Now, a temporary case in heart rate can be caused, rise in fact can be caused by a lot of different things, including dehydration. So make sure that you're drinking enough fluids. The other question that comes to mind is, can having COVID-19 make an existing heart condition worsen? Well, a heart condition could be exacerbated by severe COVID-19, but not likely after mild or asymptomatic cases as well. But the effect of COVID-19 on pre-existing heart disease are not yet really known on that front. What is the fallout really of that at this point? We'll look into that as well. All right, let's quickly open that up to our experts today. We are very delighted to have with us cardiologists from across the country. We have Dr. Upendra Kaul. He's the chairman at the Batra Heart Center. We also have Dr. Trivedi joining us from Bansal Hospital in Bhopal. We have Dr. Praveen Chandra from Medanta in Gurugram, and Dr. Davidson, who is joining us from Kerala. Let me take the first question to Dr. Kaul at this point. Dr. Kaul, in the patients that you're seeing right now recovering from COVID, what has been your experience so far, and who ends up in likelihood, as you're saying, or any telltale signs of the kind of people who are falling prey to heart problems post-COVID?
Well, I think it's just coincidental that in the last 2 days, I've seen 2 patients who had a full-fledged COVID about 2 weeks back, and their tests had become negative, and they were thinking that they're on the way to recovery, and they had classical features of a heart attack. At times it becomes difficult because shortness of breath can be a part of COVID. They all had severe COVID, on a scale of what we call as CT 11 to 12 over 25, and they presented with acute shortness of breath and some congestion in the chest. One of them has had a heart attack, small heart attack in 2015. And so he became very, conscious of that. Do I have a recurrence of that? ECG was done, it was telltale heart attack. Second patient was again a patient with a chronic kidney disease, elderly gentleman, a diabetic, who again had chest pain, and he came middle of the night today. They called up that he's having restlessness, he's having shortness of breath, and he became unconscious. And fortunately, it was a previous COVID had happened at around 17th. So he had passed that stage when COVID would be positive. So both these patients we could immediately admit to our CCU. Otherwise, we have to, first of all, take them to a suspect area. And if it is a heart attack, we manage like a heart attack. But both these patients had frank heart attack, and both of them had risk factors. But we can have COVID producing complete changes of a heart attack, even if they had no heart attack in the past, because as you in your introductory remarks very clearly said that hypoxia, reduction of oxygen in the blood, heart and lung are so close to each other, intimately related physically as well as temporally, and we know that COVID is an inflammatory disease. It produces inflammation in the body, in most of the blood vessels. We also know that blood becomes thicker and it becomes thrombotic. That means tendency of clot formation occurs. That's how they form in the lungs. They also form in the heart arteries. So some of them get a classical heart attack. So any patient recovering from COVID, or he feels that he's off COVID now, if he gets any new symptom of again a shortness of breath which is out of proportion, along with some peculiar sensation like a very fast rate or a very slow heart rate, unconsciousness, dizziness, one should always consider that it could be a heart attack, especially in those people who have underlying diabetes, high blood pressure, which is common, and these are the people who are much more vulnerable, so they have to be much more careful. Okay. Other thing is that some of the patients who already have had a heart problem, they were on some drugs which prevent a recurrence of heart attack, something like aspirin or clopidogrel or cholesterol lowering medicine. For some reason they stop it. Maybe their ignorance, or the doctor who was treating them is unaware and he stopped it. And reducing these statins or stopping statins, they can again lead to a problem in these patients. So we always advise, please continue all your medicine if you have COVID, all your previous medicine of high blood pressure, cholesterol, diabetes, and consult your doctor. Don't stop them. So this is what, coincidentally I saw it, the last 24 hours.
Right. So I think key takeaway from what you're saying is currently those not just with underlying heart issues, but even those who've not had it in the past need to be careful. watch out for these symptoms that you've talked about, I've just said in my explainer as well, and contact your doctor as soon as that happens. Dr. Davidson,
Absolutely.
if I can come to you first, come to you next actually, to try and understand, is there a vulnerable group in this area that we are talking about? Is there an age bracket which needs to be more careful?
Yeah, it's extremely important that all these elderly subset of people, people who are diabetics, people who have hypertension, these are the subset of people who are likely to have more of complications during COVID infection. These are the subset of patients who are likely to develop cardiac issues also. And we also know from the data that the mortality in these subset of people, that is diabetic, hypertensive patients with lung disease, asthmatic, these are the subset of people who are likely to develop more of complications. Primarily, when you look at heart failure, somebody who's got all elderly, these comorbidities, they are prone for having complications during COVID infection. And when somebody who's got heart failure, when he develops COVID infection, again, the mortality is going to be extremely high. When you have somebody with heart failure and COVID infection, it just goes to say that it's a dreaded complication, and it's a perfect recipe for having increased comorbidity during the hospital stay, and the long-term symptoms are also going to be bad in this subset of people.
Okay. Dr. Trivedi, if I can come to you next, these symptoms of the heart, weakening of the heart, it's not just heart attack. Again, just want to highlight this for our viewers. Do not get into a panic. Please do not do that. It is further detrimental to your health. Understand, watch out for signs, take calculated decisions. Would a good step to be would be just monitor your heartbeat on your oximeters, which now every household has, even after COVID recovery, and for how long would that be really?
Well, I think you rightly pointed out the most important thing, what we are seeing in post-COVID situation is the stress. Most of the patients are under severe anxiety, and I think this is one of the very, very important factor which is taking its toll in the form of heart attack. Now, there are additional factors, as Dr. Kaul has pointed out, and I would like to re-emphasize that summers have already started, and many patients who have recovered from COVID actually do not get well hydrated. They are not drinking enough water.
Okay.
They are very anxious, and some of them have actually left cardiac medications. On top of that, what we are seeing, it takes about at least 3 months or maybe more, since COVID is new. So we also don't know how long should we be cautious. But definitely I feel that the first 3 months are bad. They should be very careful. They should not stop the medications. And any symptom which is suggestive of cardiac ailment like chest discomfort, sweating, sudden onset breathlessness, they should report immediately to the doctor. They should not take it on their own. Other than the heart attack, which is causing death, is pulmonary embolism. It's quite common. When patients are discharged from hospital, they continue to experience some breathing difficulty and walking 1 or 2 blocks, and they start getting used to it. But what has happened is that they have already got some pulmonary embolism, and that continues to progress over a period of time. And then one day suddenly it just blocks everything and it throttles the patient literally. So pulmonary embolism and heart attack, both of them are going almost side by side in cases of COVID.
So what should such patients do really? Sorry to cut you short. What should these patients be doing then?
Yes, as you pointed out, they should be maintaining their pulse oximeter and heart rate. But let me tell you, majority of patients, those who have recovered from COVID, they continue to have a heart rate of about 100 to 120 per minute.
Okay.
So now in these patients, one is that we have to exclude whether they already have some degree of pulmonary embolism, which is there, or is it the part of myocarditis? Myocarditis, as you stress, is the inflammation of the heart, and it will take 3 to 6 months for this myocarditis to settle, and that will present with just tachycardia or palpitations. So what I suggest is that those of our patients who are having tachycardia, it's not a bad idea to get themselves screened by their physicians or cardiologists, so that at least we are clear that patient does not have baseline pulmonary embolism. This is one part. Second reason for tachycardia is that many of the patients are hypoxic because of residual lung damage. So that is another factor which is causing palpitation or increase in the heart rate.
Right.
So those patients who are getting discharged from the COVID centers, and most of the COVID centers are not being run by cardiologists. It's not a bad idea, especially after the age of 30. They must visit a cardiologist or a physician and take an advice on their baseline parameters.
All right. I'm happy you mentioned that the age group of 30, because we've of late been hearing from doctors that a lot of young people also experiencing it as well. We've had a case of a journalist here in the country also experience the same, actually lose his life quite tragically to a heart attack post-COVID recovery. Let me bring in Dr. Chandra on this point. Dr. Chandra, then are there some tests that people can do in order to ensure that they're watching out all these symptoms, especially young people who perhaps take it for granted that nothing's going to happen to them?
Yeah, Sonal, I think many important points have been brought up by my colleagues here. But at the outset, I must tell you one thing. The first and the very important thing is that occurrence of heart disease because of COVID is very rare. It is not common. So common people should not start rushing to the cardiologist or to the physician immediately. So because I have seen this thing happening, especially since yesterday there was a discussion about not getting a CT scan done. So today I was discussing with some patient and I advised them to do a CT, and they said, we have been told that CT has not to be done. So advice from the doctor is important, and do not take decisions right away and start running to the cardiologist. It is a very uncommon problem, number one. Number two is that, as has already been mentioned, those patients who are heart patients must continue their medicines safely without any hesitation, because sometimes they stop it. That is a bad thing.
Right.
Number two, many patients who are heart disease are not getting the vaccine. This is a very, very common problem in our society. Every day I get calls that, can I get a vaccine because I have been denied getting a vaccine? So everybody should know, whosoever is a heart patient or is getting a blood thinner or is a high blood pressure patient must get his vaccination. There is nothing to stop their vaccination.
But after recovery, you're supposed to wait for a window of 3 weeks. Am I correct on that? And then get your vaccination?
No, I'm talking of de novo first. De novo means first time. So all those patients who have developed COVID, then they're already got the immunity. So there is no rush to get the vaccination.
Right.
So these patients who are having COVID, there is a very small chance of getting a heart problem. And many times, as was mentioned, that heart rate can go up because of low oxygen levels. And generally it is temporary, it will settle down. And most of the hospitals have heart specialists or physicians who can take care of this.
Right.
So in general, I want to say there is no panic that everybody is going to have a heart attack after a COVID.
Right. I'm very happy you brought it up. Then, Dr. Chandra, can I ask you this? Just take me through 1, 2, 3 steps that people need to do in case, just to watch out for these symptoms, not to panic, but make an informed decision. 1, 2, 3. If you've recovered from COVID and you're feeling anxious, all of us are feeling anxious. This is vicarious grief amongst all of us, right? But what is it that they can watch out for? And also in terms of exercise, I see a lot of people wanting to just jump back into their exercise regimes in order to build up their immunity. Is that advised? But first up, 1, 2, 3 steps. Do this and ensure that you're doing this every day.
Okay. So first of all, those patients who have recovered from COVID, they should not try to jump on to do their gym and exercise, etc., to gain immunity. It will take some time, especially those patients who had lung pneumonia, or where the numbers counts were 9 out of 25 or 10 out of 25. So these numbers are floating around everywhere. So these inflammation will take time to settle down. It takes about few weeks to settle down. So there is no rush. It will settle down. And do not try to overexert. Do not try to do excessive activities, because this will lead to excessive breathlessness or symptoms without any disease happening. Number one. Number two is that they should continue taking their medications. After COVID, the heart medicines, the BP medicines must continue. The blood thinning medicines must continue. That is very important. And they should eat well, they should drink well, and relax. After 15 to 20 days of COVID, they are non-infective, so they can even go back to the family. That is very, very important. Many times people are just staying away from the family because people think that they are infected. They are actually not. They are better off than anybody else who didn't have the infection.
Right. Okay, good points, all of them over there, because I know isolation can also lead to anxiety, and that is also all of us are experiencing right now. Dr. Kaul, in your experience of treating such patients, have you seen that people with extreme COVID perhaps are developing these heart complications more, or would you say everybody who's recovered should actually be watchful of these symptoms?
See, as Praveen was also saying, that getting a frank COVID and then a frank heart attack both combined are not common. But at the same time, there is a section of population which have high risk factors. They are more prone to get it because it's inflammation.
Okay,
and inflammation can spread from lungs to heart. The coagulability of blood is more. So one should not at the same time forget that if I am COVID, I may not develop a heart attack. In fact, if you remember when COVID started last year, all over the world it was felt that where have the heart attacks disappeared? Patients were not coming for heart attacks, and it was felt that, you know, less pollution, lockouts, and, you know, people staying at home, relaxing at home is giving rise to less heart attack.
Sure.
But then we started seeing that some of these patients who were not going to the hospitals out of fear, and when they came out, they had come out with heart attacks with complications. I'm not saying COVID in COVID patient, but in general also, you know, since we're talking of heart attack and a COVID. So one should not be scared in case you have a de novo symptom suggesting a heart attack. You should not be scared of moving out.
Yeah, I think what you're trying to say is that don't be scared and don't panic either. Don't be complacent and don't panic. So that's why information is key. Information is important, and keep your doctor in loop. I think that's what really helps, because let them take an informed choice. I have last 2 minutes really. I just want to give the last 2 words quickly. Once to Dr. Davidson, please, and then I'll come back to Dr. Triveni. Dr. Davidson, last thoughts?
Yeah. It's like regarding heart failure and COVID. Primarily, you have two subset of people who had been suffering from heart disease or heart attacks and heart failure. When they develop COVID, what do? Basically, once you have problems, once you're suffering from a cardiac ailment, when you have a heart attack, what you need to do is immediately you need to phone up your doctor. You need to talk to him. Make sure that you're continuing the medication. Be well hydrated. Do not indulge into a lot of activities. Take rest at home. But in case the symptoms worsen, in case the fever doesn't subside after 48 hours or 72 hours, you tend to develop cough, you tend to develop more of breathlessness, your oxygen saturation are dropping down, you tend to develop breathlessness. At that point of time, probably one should reach the hospital and get admitted in the hospital.
Right.
But in order to always, as mentioned earlier, once you develop COVID, wait for another 2 months or 3 months before you go for vaccination. And moreover, once you start treating COVID-related problems, again, you need to continue your cardiac medication.
Sorry, I just have the last 30 seconds. Just want to bring in the last word to Dr. Trivedi, please.
Yeah, I would like to add, many of the patients are being treated by steroids. And unfortunately, some centers, even with mild illnesses, they are using with very high dosage. What we are seeing now is life-threatening fungal infections, including the heart. And this is really very disheartening. This is something like COVID, 95-98% will make it. But with these fungal infection, almost 90% are going to lose it. So I think we have to be careful as cardiologists that we have started seeing fungal endocarditis in our patients. We have started seeing mucormycosis, and probably this is all self-inflicted or inflicted by a lot of users of steroids.
All right.
So this is...
Gentlemen, I'll have to leave it there. I'm completely out of time. Sorry for that. But thank you for your valuable time. And the message to our viewers, try and keep calm. Let the storm outside pass. Keep yourself informed. That is your only weapon. Thanks for watching.